can use it in several different ways, either as a drink or as something that you can eat or to add to a salad. Also packed with nitrates and can dilate the arteries. And the third one is citrus, things like lemons and oranges. These are good with flavonoids and have many benefits, including heart health and antioxidants. So in addition to exercising and medications to help, there are some foods that you can incorporate into your daily life. The purpose of the heart is to pump blood to the rest of the body, and after the body has used up the oxygen in that blood, it actually gets pumped back into the lungs where it gets more oxygen, sends to the heart can send it back to the rest of the body. Now when this is not working appropriately, this can lead to heart failure, the inability of the heart to send blood to the body appropriately. And it can be from either the heart being too weak, it's not pumping appropriately. We label this as systolic heart failure, but it can also be due to the heart being too stiff, diastolic heart failure. A common cause of diastolic heart failure is untreated blood pressure for many years or decades. But when someone has symptoms of heart failure, it's because the blood is not pumping appropriately. And if it's not pumping appropriately, it likes to back up. It can back up into the lungs, causing shortness of breath or a cough. A lot of people who lay flat have to sit up and gasp for air. It can go into the legs, causing leg swelling or pitting edema. It can go into the stomach, causing weight gain or early satiety, where you get full very quickly. So if someone has symptoms of heart failure, we have to figure out, is it due to a pumping function? Is it due to a relaxation function issue? Is there something else that's causing this? So a good history and physical exam will typically lead us to the diagnosis. An EKG can let us know if it's due to the heart rate being too irregular, beating too fast, which leads to the heart being weak. If you have a strong family history, if you have the risk factors for heart disease, including diabetes, hypertension, you can potentially have plaque buildup in the heart arteries, which led to the heart failure. If you have a long history of high blood pressure, this can potentially lead to heart failure. So heart failure is a diagnosis where the heart is not sending blood appropriately to the organs. Our job as your medical providers to figure out why. But your job to see that if you're having any symptoms of shortness of breath or you're just not feeling like yourself, go and get seen by a medical provider as soon as possible. All right, so this one is going to be quick and to the point, and that's the importance of exercise. The American Heart Association recommends at least 150 minutes of moderate intensity exercising every single week. If you're like me and you want to go a little bit harder, high intensity exercise, 75 minutes each and every week. Why? You live longer. You decrease the risk of strokes, decrease the risk of heart attacks, decrease the risk of things like diabetes, decrease dementia. So just get that exercise in. And despite, the 150 minutes, what I care about the most is consistency. For instance, if you can only allocate 15 to 20, 25 minutes per day, do that and be consistent. Do that and watch what you're eating. Decrease the amount of salt intake, decrease the amount of processed foods. Consistency is key. You're not going to see it today or tomorrow, but if you keep doing this, after 2, 3, 4 weeks, you typically start to see those symptoms. And I like to think about it in months. The first month, you'll see the improvements. The second month, your close family, friends, the people who see you daily will see the improvements. The third month, the world will see your improvement. Let's get after it. Processed foods. Consistency is key. You're not going to see it today or tomorrow, but if you keep doing this, after 2, 3, 4 weeks, you typically start to see those symptoms. And I like to think about it in months. The first month, you'll see the improvements. The second month, your close family, friends, the people who see you daily will see the improvements. The third month, the world will see your improvement. Let's get at it. Processed foods. Consistency is key. You're not going to see it today or tomorrow, but if you keep doing this, after 2, 3, 4 weeks, you typically start to see those symptoms. And I like to think about it in months. The first month, you'll see the improvements. The second month, your close family, friends, the people who see you daily will see the improvements. The third month, the world will see your improvement. Let's get after it. Process.